Here I think is the biggest cost-benefit effect. Just pushing their strength a little bit will really help them improving their function. The big question remains, how do we get people to exercise? And we're still left with people like this, Mark Twain, who's quoted to say, I'm pushing 60. That's enough exercise for me. So the question is really, why do you want to go into exercise? So the second part here, we'll just focus very shortly on the regulation of muscle mass. If we want to get more muscle, it must mean that we should build up more muscle, we should have a higher synthesis, or we should stop the breakdown. And the question is really, when we eat, we will have an anabolic phase. That means we will build more muscle. If we don't eat, we'll lose muscle. The train will build muscle. And the question is, do elderly individuals follow the pattern that young individuals have? In other words, do they have the same synthesis and do they have the same breakdown? Well, if we just take elderly people as they sit, you can see that elderly people have the same protein synthesis and they have the same breakdown or the same protein balance. So it's not so that elderly people who just sit around, sit and lose muscle or don't build muscle. They actually do that. The important point is that when they eat, they're in a much more troublesome situation. These are results both from rats and from humans, which will show that if we eat either a mixed meal or we get amino acids, proteins, then you can see that we all will increase in our muscle growth or in our protein synthesis. But an elderly person wouldn't do that. So it seems like you're a little more resistant towards getting food in terms of building up new muscle. And that this has something to do with exercise, as shown here. That if you do 12 weeks of resistance training in elderly people at around the age of 80, you will see that they get stronger. But you will see that the muscle area, cross-section area, and the muscle fibers will only grow bigger in the ones that will receive something to eat right after exercise compared to ones that waited 2 hours eating anything, in this case 10 grams of protein plus a little bit of carbohydrate. So the elderly population, in contrast to young ones, where you would not find this picture, are extremely vulnerable towards having food intake in association with exercise, and also they might be a little more resistant in their effect than younger ones. So the obvious question in the room would be, why don't older people just eat more or take more proteins? Well, that wouldn't help them very much. This is the dose-response curve. You can see that if you take more than 15 grams of protein, you're not going to get more effect out of it. It's flattening off. So it doesn't help you just to eat more. Probably you have to eat more often, and probably you have to be very careful to take it in association with exercise. The pathways for doing protein synthesis, we shouldn't go too much into details for that, but there are several pathways which will lead to protein synthesis. And the interesting thing is that a lot of the factors involved in that are lower in elderly individuals. And that might be okay when it's just a resting situation, but that could be the reason why elderly cannot upregulate when they are stimulated by, for instance, food. So I think it's very important that there is an interaction between training and nutrition. It's very important for counteracting muscular in an elderly individual. This is a swimmer of the age of 85. So there's no doubt that in addition to the loss of muscle fibers, there's also an anabolic resistance. Elderly people are not as good in using their food as young individuals, and that will give them a deficit in the muscle protein synthesis. So they make perfectly normal protein at the resting state, but they cannot upregulate when they've done food intake or maybe with exercise. The question is, do elderly people break down more protein so that they lose their muscle much faster? Well, we really don't know, but what we do know is that muscle growth is depending on protein synthesis, but muscle degradation is also downregulated when you train. If you put yourself into bed, this pathway promoting protein degradation will be upregulated. This is 14 days of immobilization of one leg, and you will see that some of the factors here, which are indicated here, are upregulated. When you then train after these 14 days of immobilization, you have a downregulation of these factors. So muscle regulation is really also about protein degradation, and we don't know yet how elderly will respond. It looks like when they just sit, they don't lose a lot of muscle, but it's very likely that elderly who are put into bed or get sick are accelerating this pathway, so they might be more vulnerable towards perturbation. They cannot tolerate to be inactive. So maybe an upregulation of the pathway that would lead to protein degradation also plays a role here. The final thing I'll touch upon is the fact that with aging, there's something happening with our connective tissue. We know that we get thicker tendons when we get elderly, but it's not necessarily that they're stronger. If anything, they will get weaker. We also know that the content of intramuscular connective tissue maybe is increasing, but there's really a problem here because we also get a loss of the muscle fibers. So maybe the connective tissue doesn't change so much, but there seems to be an effect of this. An interesting study from last year indicated that in muscle cells that are forced to produce collagen or connective tissue, this would be inside a muscle, is actually inhibiting the further production of muscle fibers. Or said in other ways, connective tissue potentially can block the formation of muscle fiber growth. And it could be that an increased collagen formation as you grow older actually is the one that stops the building of skeletal muscle, and that's also a contributing factor. So we have three players here at the end to play with, and what I haven't talked to you about today is the fact that evidently some of the growth factors, testosterone, IGF-1, myostatin and estradiol also plays important roles in that, as does maybe some of the factors involved in inflammation. But these factors together will play the field here with loss of muscle mass. And just to end, the last thing here is the fact that I've concentrated a lot on the muscle mass. But clearly there are also other factors. If you take young individuals who are mobilized for 3 weeks, you can see that they lose muscle mass and muscle force. But their ability to activate their muscle is still present as it was before. They can voluntarily activate their muscle. The question is, what do elderly do? And in a recently conducted study, which is not published yet, we tried to unload one of the legs for 2 weeks. This elderly and young people, by the way, simply had one of their legs casted, so they couldn't move it for 14 days. The other one was moving regularly, not specifically training, but just working normally. And then after this casting, they had 4 weeks of resistance training again. Here you have the control leg. Here you have the leg that was immobilized. You can see that you lose here the quadriceps muscle, and then you retrain 4 weeks. So this is by 6 weeks, you're back to normal again. This was the young population. This was the old population. I thought that the old population should have lost a lot of muscle, but actually in this very untrained group of patients, or people, there was not a more significant loss than the elderly. Elderly, actually, if anything, there was a higher loss in the young ones. Both groups lost muscle force, quadriceps muscle strength over these 2 weeks. Here you see in the young ones, here you see the old ones. But the interesting thing was that the young ones were able to activate their muscles fully after these 2 weeks of immobilization. That means that if you put electrical stimulation on top of voluntary activation, you can't get any further force output. You're actually able to activate your muscle. Whereas the elderly really lost in their ability to activate their muscle. So taken together, this would indicate that elderly people not only lose muscle mass, but they are very vulnerable towards losing their ability to activate their muscles fully. And that is also an additional player here. So summarizing the findings, you could argue that in addition to what's happening with the muscle in itself, there's also an indication that elderly people lose their ability to activate their muscle. Not necessarily in everyday life, but if they're put through a period with disease or inactivity, they might be very vulnerable in respect to the neuromuscular capacity. So with these words, and just focusing on the fact that was mentioned also in the previous presentation, that aging is the major challenge to the musculoskeletal system. We are getting older. I know that there is obesity, I know there is diabetes, but the fact is that if you look at the populations that live the longest, it is a straight line so far. So we are getting older, so this is really the challenge. And I gotta end this with this quotation by a jazz musician who realized that he was getting old. If I knew I was going to live this long, I would have taken better care of myself. We are really facing a situation where we should see that the body can maintain that we are actually getting old. And who of us can actually resist the decrease in the level of physical activity and in order to avoid the metabolic diseases and functional deficits? And with thanking all my collaborators who worked on this, I thank you for your attention. Thank you.
you very much, Dr. Kjaer. Now we again open the...
The other thing is that I don't know what would have happened if it continued over 2 weeks. For ethical reasons, it's a little bit tough to have it for a very long time, but I'm pretty sure that you would lose some more muscle mass there. There's been some previous studies on that. And thirdly, they were not training the other leg in a type of training program. So that was just as a control. And my guess would be that if they would have trained the other leg, they would have actually have avoided a little bit of the decrease in the voluntary activation pattern on the contralateral side. But they were not allowed to train them.
Any other interventions?
Effects in elderly would probably be that you don't necessarily need to do strength training every day, because there has to be some recovery, but 2 to 3 times a week would be a very good indication. Then the other recommendation would be that not maybe to focus too much on what type of exercise, just to see that some type of exercise that the elderly can move into their daily activity, because that seems to be more important. There are several examples of diseases like osteoarthritis where it doesn't matter so much what you do, the important thing is that you do it. So that's maybe what we should concentrate on.
Thank you. One last intervention. Yes?
People in the aging 18 and above.
Well, I think there's pretty good evidence out there that the normal order that we set, say around 60% of 1 repetition of maximum being the limit for below, a young person would not have any big strength gains, but rather endurance. Doesn't fit exactly with the elderly. There's several studies showing that even using 50% of the maximal strength or something has beneficial effect. So my recommendation, and that's also been used in some of these studies, is that start with a little bit lower load that we normally would do in young individuals, and then with more repetitions. And there seems to be a pretty good effect of that as well. So if anything, even with lower intensity, there is an effect in elderly individuals.